Hey, this is Danielle or Danny of Danny's Healing Situation, and I'm officially 1 week post-op of my spinal fusion hardware removal. And if I just had to sum up how I've been feeling this week, gratitude is definitely the biggest thing. And next to that, I feel good. My pain has been managed really well, and I had a shorter hospital stay than we all anticipated, so that makes me really happy. So I'm at home, I'm taking it easy, I'm moving pretty slow, but all in all I feel pretty good. And I'm going to remove the glasses because the glare is bothering me, so don't mind me. Anyway, I'm just going to talk about that first week since surgery, how it's been, what it looked like, and what my doctors filled me in on. So on Wednesday, before surgery, before they rolled me off to the operating room, you will, if you're in this situation, you'll find yourself talking to a lot of people on your treatment team, and they just go over what their surgery is going to look like, and they just ask you a million times if they're the right person, if they're going to be operating on the right person. So you're going to be reconfirming that information a lot. I felt pretty good rolling into surgery. I was a little nervous. I got teary-eyed for a second just because I was anxious and anticipating being on the other side of it, but all in all, I felt well. The night before surgery, I slept really well, better than I thought I would. I felt really calm and I felt really protected, so I was happy about that. The day of surgery, after I got out of surgery, it ended up being 4 or 5 hours that I was in surgery, and the rest of that day is kind of a blur. I was definitely still feeling the effects of the anesthesia, and I was sleeping on and off all day, but of course they're doing a lot of blood work, they're still checking your vitals, and then people are waking you up all the time basically in the hospital. So I honestly didn't get much sleep at all while I was there, but the entire team was great. And after I got out of surgery, due to the infection that was in my body, I ended up having a PICC line installed into my arm. It's basically a special IV that goes through an artery, and it goes over my heart, and it allows me to give myself the antibiotics that I need to fully clear out the infection. So my orthopedic surgeon, whenever he opened me up, he went into my back, he made a large incision. So the incision that I have now is bigger than any incision that I've had from any prior surgery, because even though the infection is from my hardware, which is only half of my back, it could be anywhere in there. And this might be TMI, it's a little gross. I was very surprised to hear it, but they basically told me when they went in there, they're positive that the hardware was the cause of infection, and there was just a lot of purulent fluid, which is like pus or some sort of drainage, some sort of infected looking fluid that was in my back. And there was one screw at the top of my incision that had somehow become loose. And whenever screws are loose in your hardware, any type of hardware, regardless of the reason you needed it or where on your body it is, if the hardware is loose, it can cause infection. So this one loose screw caused this massive infection in my back. And so they cleaned me out, they scraped me out, they cleaned me out, they scraped me out. And my orthopedic surgeon did tell me he did go down to my hardware where my spinal cord was and clean out that area as best as he could. He told me there's some parts he couldn't get to because of the delicate nature of your spinal cord, but he feels confident that with the antibiotics that I'm now taking, that infection will clear out as well, especially since the hardware is no longer in me. So after my orthopedic surgeon, my plastic surgeon came in, and he was able to close me up, which makes me so happy. I was ready. I was anticipating having to do the wound vac again. I was anticipating having an open wound again, and it just makes wound care a little more complicated. And I think my body's just like physically tired of having an open wound, so he was able to close me up. I'm sutured and stapled all the way down. And I actually had my follow-up appointment with my plastic surgeon today. He said it looks great. He's happy to see that I'm walking and feeling good, and he feels really confident that this is going to be the last of it for me. It's been a long road, and it's been hard to figure out, but he's confident that this surgery will be the last and that I'll just fully recover after I'm finished with these antibiotics. And I'll probably make another video on how I found my team, my orthopedic surgeon, my plastic surgeon. It was a very long road, and there are a lot of little bits of fate that happened that allowed me to be able to work with these two incredible doctors that were willing to take my case on. Anyway, Wednesday is when I had my surgery. On Friday, discharged. And like I said, my stay was unremarkable, which is a good thing. I really slept a lot. I had the PICC line installed. I did have to get a second blood transfusion. For some reason, my blood count was really low, but I am anemic, figuring it out, I don't know why, but I am anemic, so they did have to do 2 blood transfusions, but other than that, there were no major complications. I will say the hardest part so far has been getting up and sitting down or getting into and out of bed. That's when I feel the most pain. And also driving. I haven't been driving myself, but even riding in a car is really uncomfortable. And if you know Houston, you'll understand that these roads here are tumultuous. So it definitely is not comfortable to travel by car, at least that first week. So I feel pretty good in that sense. Since I've been home, I have had the home health nurse come to teach me how to do the PICC line. I'll also probably do a video on this, but I'll show it. It stays right here on my arm, and I won't get into the details of it because I'm not a medical professional, but I'll just share my thoughts on it or what I think it does. But basically, it is inserted into an artery here, and it goes to your heart. Whenever they're installing it, they did numb me, so I didn't feel anything even though I was awake for that procedure. Whenever they are doing it, they take an ultrasound of your neck to make sure that the lines did not end up in your neck versus over your heart where they're supposed to. So every 12 hours, I inject myself with my antibiotics and saline and another syringe of something that helps just make sure that the PICC line stays clean and that there are no clots. It's been really important to take your medications at the same time every day since they are antibiotics, and that's how they're the most effective. So there's been no issue with that. They taught my husband how to do it, and they've taught my mom how to do it, but I'm able to give myself the injections. So honestly, this first week has been really smooth. I'm walking very slowly. I'm doing everything pretty slowly. I'm not lifting anything heavy. I'm not doing anything laborious at all, especially those few days after the surgery. Even after coming home, everything made me exhausted. Everything felt really difficult to do. So I just allowed myself to rest. It's what my body is telling me to do. I'm not fighting it. If I feel tired, I'll just sit down and call it a day. I will say I did have one instance of extreme stubbornness the day of surgery. After surgery, later in the night, I've been asking, I'm ready to get this catheter out. I don't like wearing catheters. I don't think anyone does, but I was very ready to get it out. And I asked the nurses a couple times, and they're like, okay, we can take it out. And I was happy when it came out. What I did not consider is how difficult it is to get out of bed after back surgery, to go to the bathroom yourself. So looking back, I think I did rush that process because it's so laborious to move yourself out of bed. It's a slow process just to get from bed to bathroom. But I was pretty adamant for, if you know me, you know there's random little things that'll just bother me and I'll hyper focus on it, and that was one of those little things for me. But I laugh about it now, and it caused no real issues. So I definitely feel like I've had people praying for me this entire time. I feel the praying grandmothers and all the praying great aunties and the praying friends and everyone that just looked out for me. I really feel that, because after coming out of surgery and hearing that my doctor told my husband the surgery went as well as he thinks it could have went, he said it essentially went perfectly, and that makes me feel really good. It gives me a lot of peace because I haven't gotten that confidence from these last 2 surgeries that I've had. So now that my mind is clear of this infection and just allowing the antibiotics to work and allowing this resting to get whatever's left inside of me out of me, I'm leaning into the rest. I'm leaning into the healing. I really want to get to where I was strength-wise. I want to get back to that place, and I'm looking forward to doing more things active. One of my goals for next week is going to be to go to the park and do 1 lap. It's a mile. I just kind of want to see if I'll have the energy to walk it, or if it feels comfortable, because as I mentioned, I'm walking very slowly and it can be painful sometimes. But that's my goal. I hope sometime in the next week I can get outside and walk somewhere. I am on leave from my job, so I'm trying to fill my time with as many things as I can, but in a thoughtful way, because I know that's not what I need right now. So yeah, this is week 1 post-op. I'm feeling good. If you're in this situation, I think the biggest thing, especially once you go home, is to be on top of your pain management. And if you need home health, make sure that that gets set up, or someone to be with you. However, you're going to manage doing the things that you need to do without jeopardizing your body, jeopardizing your rest, or making yourself feel worse than you need to after having surgery. So I'm super happy that I've been able to move about my day with the assistance that I need. I'm not going to say that I'm doing the things that I need to do right now by myself. I have really supportive people around me that are helping me with the day-to-day. And even though I want to hold on to that independence of the little things that I can do, I know my body is calling for help, and I know when my body is calling for help, and I'll do that. So I hope to update y'all again soon. Hopefully I get to the park and walk my 1 mile. And yeah, this is Annie's healing situation, week 1 post-op.